Today we're going to talk about sex addiction and how is sex addiction maybe different from other types of addiction. We have here Dr. Claudia Rodriguez. Guys, she's an addiction psychiatrist originally from Colombia, raised in South Florida, and medically trained in Boston. She has an expertise in the treatment of addiction and co-occurring psychiatric diseases. She has held leadership and clinical roles in Boston in one of the most renowned medical systems prior to returning to her home in South Florida. She's now the founder of Reclaim Sunshine Psychiatry, and we are so blessed and lucky to have her here. So guys, welcome back to part numero dos. So guys, tell me, so I worked as an addiction therapist in 2006. And back then, I think South Florida, at least in that treatment, it was a day treatment facility, and they were treating addiction very differently. It was a little bit too black and white for me. Didn't have a lot of experience. I was doing other types of therapy, but I've always been someone that I want to learn from everything. And I remember back then, as we were doing the groups were focus on cognitive behavioral therapy, triggers. There's a lot of things that were being talked about, but sex wasn't being one of them. Mm-hmm. What I remember now, I know a little bit different being a sex therapist. But guys, what do you think? How is sex talked about in addiction treatment? And how do you see that addiction different from other types of addiction?
So I'll start if that's okay. It's interesting because the world changes, but it takes us a while to get caught up with what we should be asking and talking about. So I would say, honestly, in the medical field, when we talk about sex, we don't talk about it enough. There's so many aspects of sex with or without addiction that are important in someone's life. And so, just today I gave a lecture and we were talking about chemsex, which is using substances to have sex, not like in the performance of sex to enhance performance or to just enjoy the act of sex, and then how that can change behaviorally how we feel about having sex. But the truth is that we don't talk about it often enough. And in fact, when you look at questionnaires, when a provider has like an initial assessment, sex is not usually highlighted as part of that process. We really owe it to our patients and individuals who come to treatment to talk more about sex, given how important it is in our life and in our relationships and intimacy and connection. And then as far as sex addiction itself goes, again, we might ask questions about internet, gaming, pornography, but the truth is that the DSM-5 hasn't even actually formalized the disorder of sex addiction. And so it's a little bit tricky because while we know that there is this kind of compulsion in some individuals, or we realize that people in the same diagnostic criteria develop tolerance to sex. They need to have more sex to achieve the same level of pleasure. Withdrawal, even if you ask someone to stop watching pornography or decrease the amount of sex they're having or start to manage that, that's hard to do. People have insomnia. They can actually become really depressed. Like lots of the same symptoms that we see with drug addictions can happen with what we would call sex addiction. And then we also see treatments and kind of like changes in brain chemistry happen in a similar way. How we react to cues in relation to drugs in the setting of drug addiction, similar to sex addiction. If you put someone who has a sex addiction in front of a TV and you show them pornographic images, their brain actually responds differently. And this is shown in studies than someone that does not have the same relationship with sex. So there's lots of similarities, not a lot of work around it, and also not a significant recognition that this is actually something people struggle with.
And I think when you talk, Dr. Ruiz, because sometimes when we talk about the medical field, I've ran into situations where clients of mine say, Paula, I had breast cancer and I went to the doctor and, I'm telling the doctor, like, listen, I'm not feeling as sexual, right? Like, it's been really hard for me. And the doctor says, well, but you don't have cancer anymore, right? Like, so, why sex? You're fine. So I think we still have such a long way to go. And I think for me as a sex therapist, it's like, how do I help people change their relationship to sex, which is a little bit different. It's like, we don't want to change our relationship to cocaine, right? Mm-hmm. Like we want to make sure that that's just out of the picture.
Right.
So I think, there is definitely a difference there. What I see a lot, childhood trauma, is one thing. Impulsivity, right? Sometimes bipolar disorder can also be a predisposition. But one of the things that's really interesting is, also these guys that have, it's like a perfect storm, haven't really learned how to deal with rejection well. And so this just becomes a place, I'm stressed. I'm replacing all these things with this addiction. We in our field, or at least I in my field, in the field of sex therapists, there's the people that call it sex addiction. There's the people that call it sexual compulsivity. I am on that side. So I think, and it is true, it's not in the DSM. So I think, thank you for sharing that as well, to remind people that that's a thing. John, what do you think?
I think when you're talking about somebody that struggles with a substance, usually there's telltale behavioral. Many substances, you can do a pupil check. Stimulants will increase the pupil, opiates will decrease. You drink enough alcohol, you'll stumble. But when you're talking about sex, it's very private. So you have no idea what I'm doing behind my closed door. You have no idea how I'm acting out. Whereas, so if it becomes problematic, somebody with a substance, it's right in everyone's face. But if it becomes very secretive and private, the other thing is, I think, of the 4 human passions, hunger, thirst, sex, and sleep, 2 of those take care of each other. You stay awake long enough, you will fall asleep. And if you don't, there are nightly releases for your sexual release as well. You do have to eat and drink, but so like, you can't just stop having sex.
Right.
You can stop using cocaine, but one way or another, that sexual and you'd be able to speak more about it. It's going to take care of itself. But when you have that compulsive behavior coupled with the shame of it, it just goes into like the darkness, which leads to an intensification of the shame.
Oh my God, Anjan, you talked about something, because already, guys, in our society and in our culture, sex is not something that's openly talked about. So I've had guys that, behind doors, stay up hours, masturbating, consuming so many hours of porn, even hurting their penis, their shaft, to a way that it actually hurts them physically, right? But the courage to actually go to a therapist and say, this is what's happening, because we cannot treat what we cannot see. And so I think when you talk about the shame and these things that happens behind doors since we're little, right? Like, and this, it's very sad to know, but in some schools still happens, where they put a bag that's really dirty, paper bag, and a bag that has like glitter and stickers. And they tell the girls in the class, which one do you want to be? Do you want to be dirty or do you want to be clean? Right? So I talk about this erotic garden all the time, because we all have a little garden and things have been planted in there, messages about sexuality that we're not even aware of. Even before we're becoming sexual, already all these things are being planted in our garden. And to your story, John, when you talked about, I eventually started, getting women to sleep with me so I could never talk about my life as a sex worker and what that was like. So hiding that part of you, and how do you reconcile now being a sexual person after engaging in those sexual acts? So I think the start is to be able to address it and talk about it, because again, as you guys highlighted in our first episode, you're not alone. You're not alone. I work in Miami. Guys, it's a very stimulating city. There's anything you want. What you want. We got it. Right? Strip clubs, sport, you name it. So I think I see it a lot. And there's definitely, I wonder, when we think about predispositions or things that you guys can think about, Dr. Ridges, I'm wondering, what do you think about bipolar disorder and the impulsivity, and how that could play a role in sex compulsivity or sex addiction? But what are some things that you think lead or make people prone or predisposed to developing sex addiction?
Well, it's tough to say with sex addiction specifically, but with behavioral addictions, which this would be a part of that, the risk factors are pretty similar. So adverse childhood experiences, you talked about trauma. It could be sexual trauma. It could be other types of trauma, experiencing violence in the home, having a home that has financial instability. There's lots of adverse childhood experiences that actually increase your risk of having a mental health illness and also potentially having an addiction as well. And those 2 things kind of coexist. And I think one of the things that you also highlighted was this kind of avoidance that you find in a substance, in sex, in a behavior, in gambling. And that plays a huge role. When we think of trauma, that's why trauma is such a big factor, right? Like a big way that people live with trauma, with post-traumatic stress disorder, is by using something that helps them avoid those memories. And when you lose yourself in sex, when you lose yourself in these things, it is impacting your dopamine system and allowing you to feel better for those moments of time. When it becomes problematic is when it starts to kind of impact hours are lost, or, you know, you can't make it to work on time, or you're not having sex with your partner because you're engaging in other acts. And so all of those things are potential risk factors. I would say, just to touch on bipolar disorder itself is not necessarily a risk factor to having sex compulsivity, but when you have a manic episode, which is the other side of bipolar, one side is depression, one side is mania or hypomania, during that phase, you can have hypersexuality. You can overspend. You can have sex with multiple people. You just have this kind of like increased impulsivity to do things that you wouldn't necessarily do in the absence of that episode. And so it could be a part of that picture as it presents itself.
And I want to add something that you said, Doctor, because, you know, childhood trauma, what I notice a lot of the times is it could be with anything, right? But before the age of 6 or the age of 7, the kiddo is living in a home where there's a lot of traumatic events, they find a magazine, right? Like now our kids, unfortunately, you know, we don't have good sex education in our schools, yet we can pick up our phone and there's so many, like Pornhub, guys, there's so many things that are coming our way. So imagine. So I think it's just so important to educate. But with trauma, I get to go into this fantasy world, right? Because my reality is too hurtful. Right. There's too much going on. John, any other thoughts that you have about?
Yeah, I think there's a great parallel between that. In the industry that I work in, we talk about fill in the void. You know, so I have this void that there's never enough, and so I try to fill it with alcohol, and there's not enough. I try to fill it with cocaine and opiates and benzos. It's never enough, and then I get sober, or what I get abstinent, and now I'm swiping right on every dating app, and I'm dating 17 people at once, and I'm compulsively watching pornography. It's still another void filler. But like sexual release is just the same as using any substance. There is a temporary euphoric feeling. It feels great.
Absolutely.
Then the shame comes. Yeah. And so now I just wait until the next time. And so a lot of people that put the drug down, they turn into other addictive behaviors: sex, eating, shopping. It's just most addicts don't know. I run group therapy, and I always joke around. I was like, I'm going to tell you a word that you guys don't know about. We're going to talk about it. It's called moderation. And people laugh because they've never done anything moderate ever. Like, I've never done it. It's like, oh, we're going to do it to the extreme. So now I put the drug down, and now I have to do the extreme sex. So yeah.
Yeah. And sorry, can I just add one quick point? And I think that's a tricky part. You said, John, earlier, like sex is part of life, and we need to highlight the importance of sex. It's kind of like, you know, you can't tell someone not to eat. You also can't tell someone not to have sex. Like, it's a really important part of everything. And it is one of like our survival mechanisms, actually. And so I think that's one thing that stands out with other addictions, that when it comes to treatment, you are working on developing a different type of skill that's different than the type of thing that you would do when you want to kind of, you know, gain a life without, or live a life without cocaine, alcohol, or other substances. And that's a tricky kind of like, you know, line to navigate.
Yes, guys. So childhood trauma, shame, you know, with bipolar disorder, as Dr. Reese talked about, the manic states, you know, all these things. Listen to all of these things, because sometimes I have calls, you know, and you know, the patient says, hey, like, I think I'm a sex addict. Okay, tell me a little bit why. Well, I've been masturbating daily. Okay, what else? But when I find out, when I dig a little deeper, this person grew up in an extremely religious household, right? Like, so we really need to understand, you know, is this a thing for me? And talk about it, open up about it, because I think that's the most important. Remember that shame does not survive in compassion and understanding. It only thrives in secrecy and judgment. Guys, so we talked a little bit about the start line. what, if I'm struggling, where can I start? Thank you guys for that. So to wrap up this episode, in the previous part 1, we talked a little bit about if somebody's struggling with any type of addiction, right? Like, where can they start? And you guys gave us some ideas in terms of where. But for somebody that's in long-term recovery and they're struggling and they're having doubt or urges or cravings, what are some things that's gonna, the little push that people need from time to time? What would you want to let them know?
I'm a firm believer that the 3 of us would have all different value systems. Our moral compass is different, and it's only different because of the experiences of our life. Somebody in sobriety, I would encourage them to act in accordance to their value system, not someone else's.
Yes.
Because when you act in accordance with your value system, there is no shame. Ayn Rand, the author of Fountainhead, says the happiness is the state of consciousness that comes from the achievement of one's values. So whatever you value, if you act in accordance with that, you will find happiness.
Love it.
That's beautiful. I think also in those moments, like, try not to get stuck in like, why am I having this thought? Why am I thinking about using? Why? Right? Because it builds on that like feeling of like, there must be something internally wrong with me, or I'm defected because I'm having this thought. And I just coming from like a neurobiological standpoint, like the areas that are impacted by addiction it's a reward system. It's a primitive system that really doesn't forget. And it doesn't forget because it's meant to help us survive, to get food, to have sex, to have companionship, to drink water. And that's the same area that's impacted by drugs and these behavioral addictions that we talk about. So if those thoughts come, they will pass. Reach out to people that you are connected to. Follow your value system. I love that. Be true to yourself. And again, I think as Johnny said earlier, like, don't forget that you're not alone and that there's always people out here. And even with me as a psychiatrist, like, when my patients don't need medications at some point, or they decide to have no medications as part of the treatment, we continue having conversations, even if it's every 3 months, 4 months, 6 months, just to connect, just to check in and to kind of like verbalize things around this part of your story. And I think just like John said in part 1, there's nothing that he would change, even though there were moments of his story that were very stressful and sad and, what have you. I think also taking pride in kind of how far you've come, and let that be the driver to your ongoing motivation.
Yes, and both of you talked about connection, feeling connected to themselves and connected to others. Because guys, we all hear about generational trauma, but I feel that the worst type of trauma is when we become our inner perpetrator. When we start to say, well, why? I'm bad and this, so how can you become your inner ally? What is it that your little inner child needs to hear? Give him a hug, tell him that it's going to be okay, and that these things are going to happen through this really journey of courage and triumph. Thank you guys for joining me.
For having
guys,
us.
see you soon. Remember that I believe in the power of community. So you have anyone that can use this information, please share it with them. You can find Dr. Rodriguez and reclaimsunshinepsychiatry.com. John, thank you so much for joining us today. It was really amazing to hear your story. And remember, guys, 2 parts. Don't forget to look up part 1 if you haven't. Thank you y nos vemos.
Thank you.